Welcome to Health Chat, the forum where we bring awareness and education to health issues that directly impact our community. My name is Dr. Correa. I have 26 years of clinical research experience, and during this time I developed a passion for addressing health disparities and health equity. In an effort to put my passion to action, I created Health Chat. This program will feature guests sharing their stories and personal experiences in order to promote health and wellness. Today's guest is Emily Grace. She will be discussing with us her health story. So Emily, tell us a little bit about yourself.
My name is Emily Grace. I'm 12 years old and I'm in 7th grade.
7th grade. Now, if I remember correctly, when I was in the 7th grade, that was called junior high. I think you guys call it middle school now.
Yeah.
Right, okay. And that's a time where you were changing classes, getting a little bit more independence. All right, so what's your favorite subjects?
Probably reading or history.
Okay, now do you have a favorite book?
No.
No favorite book, but reading and history. And so what do you want to do when you grow up?
I want to be a special ed teacher.
A special ed teacher. That's pretty dynamic. I have a special heart for people who can, work with special needs kids. So you have a special story, actually. So tell us a little bit about your health story.
So I'm a survivor of stage 4 neuroblastoma. So.
Wow. Okay, so now for my audience, neuroblastoma, and she just said she's a cancer survivor. This is a rare cancer. Less than 20,000 people have neuroblastoma, which is pretty rare. And, I know, and unfortunately, I have a little cousin that had neuroblastoma. Her name was Brianna, and she passed at the age of 6. So I know years ago the survival rate wasn't as high as it is now. So this is a blessing to have you here sharing your story with us. So how old were you when you were diagnosed?
I was 3.5.
3.5.
So, little one.
Little one. Do you remember any of that time when you had cancer?
I remember a little bit. I don't remember as much as I wish I did.
Okay. So the things that you remember, let's talk about that. Try to go back with me. Tell me some of the good things that you remember about that experience.
So one of the best memories that I have is my mom used to celebrate every little milestone. So she would put a party on everything.
Okay, every milestone. What were some of the milestones that you had?
So one of them was a 75-day party. So it was after 75 days of being in the hospital, she did a party and there were like party hats and just made it a fun day. And then when I got my tumor taken out, she blew up posters of what the tumor would look like, and then we threw marshmallows at it, and we had all the nurses come in and like stomp on it and sign their names. So
all right, so you killed the tumor.
Yeah.
Okay, I love it. So mom really got everybody involved in that process, and you actually can remember that at that age, which is even more dynamic. I'm sure there were some bad times. What were some of the bad things that you remember?
One of the things that I wasn't so happy about was the nose tube. I used to have to get one every time, like every other day, basically.
And what did the nose tube do? What, maybe some of the people don't know what that.
So I wasn't able to eat, so the nose tube allowed me to get enough food for me to be healthy, I guess.
Okay. So you're a cancer survivor, and now the tumor's gone, and you're obviously healthier, but you have things that remind you that you had cancer. What are some of those things that when you see yourself today, maybe something physical or mental that, maybe someone else might not even recognize?
Right, so I have hearing aids, and I lost my hearing from medicine. So that's really one of the biggest things that I still have.
Okay. Now, you had the tumor removed. Did you get any scarring? Yeah.
I did, and one of the things that I loved about my scarring is my mom always told me to be proud of it. Not everyone has it. It's something that makes you special.
Absolutely.
So we have a family friend, and she was like self-conscious about scars that she had, and I was able to. So my mom didn't want me to wear a bikini, and so I was able to use mine and be like, look, you should want me to. I feel confident in myself. So I finally got to.
Yeah. So I get it with the scarring. So I also had a tumor. But it wasn't malignant, it was benign, and it was under my arm. And they had to take the tumor out, and it left a nice big scar. So in certain clothing, I don't want to lift my arm up, and everybody can see that big scar under my arm. And it left me with a condition called lymphedema. So, you know, my hand is always swollen, and I should be wearing my sleeve right now. I'm being bad. But, you know, sometimes we're not compliant, and that's not good. But I'm getting better at it. I'm getting better at it. So, interesting. So you wore a bikini regardless of your scars, huh? Right. Okay, I love it. That's right. You're motivating other people out there. Be proud of your scars. I know women with breast cancer, and they have mastectomies, and they have scars there as well. So definitely one of those situations you want people to know. So okay, so now that we know that you survived cancer, you are 12 years old. What would you want someone else to know about that? Maybe they have cancer. Maybe they know of someone that has cancer. Is there anything that you'd want to share with them?
So one of the things that I would want people to know is don't think of it as always the worst thing. Like, don't make it a dark and scary process. Make it fun and celebrate every little milestone. So make sure that that person is having, like, I guess having fun, kind of. Make sure it's not everything sad. Make sure they're still celebrating.
Right. So now that you're a cancer survivor, you are celebrating. I didn't even talk about this, but one thing that we can't miss is this beautiful crown on your head. So tell me about this. You know, what are you doing? It looks like you're about to step into the world of pageantry.
So I'm involved with the pageant, Next Level pageant. So basically it's a mentoring program for young girls.
Okay, awesome. I know a little bit about that system. It's actually really good. And mentoring is a really important part. And if you haven't done a pageant, I know they do a lot of that for young girls who've never been a pageant, actually any age. So it doesn't matter if you've never done a pageant and you're interested. They give a lot of mentoring to people so they can understand the process, the different interviewing, how to walk, and all of that. So I know you're looking forward to it. Have you gotten anything ready for it? Have you gotten your gown or anything?
No.
All right.
I'm excited to, though.
You're excited to. So you're going to be shopping on getting ready for that process. Okay, so let's go a little bit and talk about this. And it's interesting that you're able to talk about it because not everyone will maybe even have the opportunity or to know a child with cancer and to survive. So maybe it's a different type of cancer, and you're telling them it's not the worst. There's definitely something good could come out of it. So what would you say if something good that came out of it for you?
Well, I came out stronger, and it's something where it put kind of in perspective of life. I was able to kind of like be confident in myself, knowing that I overcame a lot at a young age. So most people were like, "Oh, like I'm not that amazing," and you are. Like,
you are.
Overcome
You are
something.
that. You are that amazing. Okay. Now, when you first went to school, you were sharing with me earlier how children probably didn't understand the whole hearing aid and they weren't too respectful of your space. How was that?
So, when I first went to school, it was hard because I was used to being with my mom all the time. And so when I went to school, I had a lot of separation anxiety. So they would kind of be like, "Why are you crying when you're going to school?" And then also I had hearing aids. So they weren't really thinking about it, and they kind of just like stick their fingers in your ear, play with them, pull them out, like, "What's this? Why do you use it?" So
Wow. Yeah.
they didn't really know what else to do, but it wasn't the most amazing experience.
Right, absolutely. So it's very important for us to make sure that we be mindful of one, someone's personal space, and if they see something, maybe just to ask, you know, what is that? Why do you have it? How did that happen? So I think even as adults we can learn that, and then we can more importantly teach our children to be more mindful of that. So I always want my audience to go, okay, so this was interesting to hear her story. This was something, it was very good for me to hear, but what are the takeaways? So I always want to give people at least, 3 or so takeaways that they can always remember about Emily Grace, what you went through in your story. So the first item we want to make sure we kind of like just touched on it was about not touching. Explain that. So the one big thing about touching.
So touching is like parents would say, "Oh, don't ask her, don't stare at her." And really, it's better than them going up and putting their finger in your ear or touching maybe something that you have that's different from what they have. It's okay to be curious and maybe ask them, or if you don't know, like, that's okay.
Absolutely. Okay, so we're definitely going to take that advice. And then what would be the second one? We talked about it earlier, and it seemed like your mom was she was the best of doing this. She probably helped other people in the hospital. So what would be that second item you'd want people to recognize?
So, like I mentioned earlier, you just want to celebrate. Don't think about it and be sad all the time. Just celebrate yourself. Like, you're amazing. You've done so much. So, every little milestone that you have, make sure you're celebrating that.
Right, absolutely. Celebrate your milestones. I think, I always like to let people know there's a saying. It says, that if you can just put something in front of you and you can see, I have vision boards. And as I see something, it's really amazing. I love it. I have them in my office. And as I've accomplished something, I'm able to put something new on my vision board. But putting it in before me and letting me see it, it helps me.
Right.
So that's a really good one. I love that. So we got to get people to understand to celebrate their milestones. And even if they're going through something, letting them know, okay, I've gotten through this stage of this illness or this disease or whatever it is that they're going through. Love it. So the last one kind of is what made you become the person that you are, and it makes you want to go into special needs. So what would be that last most important thing that you'd want people to be mindful of?
Whatever you do, even if you feel like you can't handle it, you can. And at the end, you're going to come out stronger, and it's going to shape who you are. And if I maybe hadn't had cancer, then I wouldn't have the level of patience or understanding for a special needs child.
Absolutely.
So it shapes who you are.
Shapes who you are. So Emily has been shaped, guys. And what's amazing is we're going to see her many years from now. She's going to be a special needs educator, and we're going to all be just thankful for what God has done in her life. And I know that I'm thankful, and I'm honored to have you here with me. I just want to let you know we appreciate you. In every way possible. We totally appreciate you. Your smile just resonates. So thank you so much, Emily, for sharing your story and sharing it with such confidence and comfort. We're talking about cancer and she's smiling, guys. This is amazing. So thank you so very much. Also, if you have any ideas, any suggestions that you want me to talk about or bring up, please do not hesitate. Give this a thumbs up. Please email me at Karen@drkarencorrea. Please go to my website at www.drkarencorrea.com. I want to thank my husband for all of the technical support. I want to thank Emily. And last but not least, I want to thank everyone for chiming in and listening to Health Chat. Thank you, everyone, and have a great day.